Today we're going to talk about my experience with Care for Her and the Adventist Ukiah Valley Health Center and my experience giving birth there, postpartum there, and all of the things. So let's get into it. Hi, my name is Kasie Gray. I'm a realtor, Ukiah expert, and I love helping first-time sellers buy their dream homes. But today I'm going to talk to you a little bit about my experience becoming a mom. I got pregnant in 2020, and the first place I went after taking a test was straight to Care for Her. And what they do there at your first appointment is confirm your pregnancy and sit you down with a counselor, and they walk you through the steps, explain all of your options, and were super helpful. And then they go ahead and schedule your first exam, which is when you'll do an exam with an ultrasound. And at the time that I was doing it, you weren't allowed to bring anyone with you. I'm not sure, that's probably changed now. The staff was always wonderful to me. How Care for Her is structured and laid out is there are midwives and then there are several OBs who oversee them. So each time you go to an appointment that's not an ultrasound appointment, or if you're not high risk, then you're seeing essentially usually a different midwife every single time. I maybe got 2 or 3 midwives multiple times, and that's saying a lot because of how frequent you have to go towards the end. In the beginning, you obviously meet with a doctor and they do the ultrasound for you to see the heartbeat and all of those things. And then you have monthly or maybe every 2 or 3 month appointments to go check on how you're growing and walk you through, what you might be going through, if you have any questions, so on. I would always get too nervous to ask any questions. And I think that's maybe one of the things that having a new midwife every week could affect depending on your type of personality. I would have questions in my head and be like, it's just a silly question, I'm not even gonna bother bringing it up, which I probably should have, but they were silly questions, like stuff I could just Google. And so those appointments are pretty quick, and then like I said, you're meeting with a new midwife each week, which also one of the things that I like about that is that maybe one midwife that saw you last week didn't have a concern, but this one does. And so you're just kind of getting all eyes on the fact that you're growing a child, which is wonderful. And then at your 20 weeks, you'll do an ultrasound at a separate ultrasound tech office, and they'll send your info over to Care for Her, and they'll go over it with you at another time, which is definitely interesting. We did do the lab test for blood and everything to figure out the gender and any chromosomal abnormalities. At Care for Her, those results were accurate for us. I also did, because I'm impatient, the at-home mail kit where they just pretty much flip a coin and it's either yes or right or wrong, because there's only 2 different sexes to guess from. So I don't know how accurate that is. Anyways, I definitely loved a lot of the midwives, and it's cool that you get an opportunity to meet them. Scheduling was super easy. You do have to call, and then once you get towards the end of your pregnancy, you end up having to go every 2 weeks, every 1 week, which is a lot. And the appointments are really fast, but you do have to wait, and you do have to go pee in the cup every single time. Just a lot. But I think that if you're not a high-risk pregnancy or you don't have a lot of abnormalities, then Care for Her is a wonderful opportunity to just smoothly go about your pregnancy, and I know a lot of women that use it and like it. I definitely had no complaints about it. When I did have to, a couple of times I had seen a midwife 1 week, and then the next week they would say, you're measuring a little small, go to the hospital, or we want to check your fluids or whatever it might be. So they'll send you to the hospital, and the nurses there will take care of you, and then they have a midwife or a doctor on call at the hospital at all times, so they rotate through who's over there. When it came time to give birth, I was a little late. I was 40 weeks and 6 days when I eventually gave birth, and I think that they had my due date wrong, and I think that it was I was 40 weeks like on the dot. But at one of my weekly appointments, my blood pressure was low or high, one of the two, and I hadn't had breakfast yet. So they said, can you go to the hospital in 30 minutes? And I said, you betcha. Can we make it an hour so I could go get some food? And then I went home and curled my hair and got chicken fried steak from the Maple. So, you know, priorities. And then after I went to the hospital, my blood pressure was fixed because obviously I had 8. And so they monitored me for a little bit and then sent me home. They were full of people giving birth. And so I went home, stayed home and then they scheduled to be induced for the next day. We showed up at 8 a.m. I was in the room by like 9. I was getting Pitocin at like 10. And then by 12, I wanted some sort of pain reliever, and they gave me a drug that I highly recommend against. I think if you're gonna go for drugs, just go straight epidural and don't get any of whatever else they have to offer you, because that made me feel 10 times worse. But the nurses and the staff and everybody was super lovely. You have a couple of nurses managing just you, and then you have the midwives that are coming to check on you and see how dilated you are and everything. And I had never met the midwife that was at the hospital that time. I had met the midwife that saw me the night before, and they all have very different personalities, and I think that's one of the things about Care for Her, that you kind of have to be willing to be flexible on how you communicate with people, because they all have very different personalities. So if you want to find somebody that fits your exact communication style and way that you would do things, then that's something that you need to think about beforehand. But I was pretty flexible when it came to, as long as somebody said to catch a baby, I don't really care. Eventually, after going through labor, it was about 5:36 and it was shift change, and I was like essentially very close to giving birth, and the midwives had to switch midwives on me, and also the doctor was on call and not at the hospital, so they called her in because I was having some complications. So in between, like about to be giving birth, I stopped and then had to wait for a new midwife and the doctor to come into the hospital and to oversee. Essentially the midwife did everything and the doctor just hung out in the room to make sure nothing went wrong. But it was a lovely process. Even with all of the issues that I was enduring, the baby's heart rate kept dropping, and I had low fluids, and the nurse took out the catheter monitor to monitor the baby's heart rate or contractions. And I had an epidural, so I had no clue when I was having a contraction, and we no longer had a monitor. They handled it with grace, and eventually she came out healthy and happy. I think that last phrase when the doctor's like, okay, 2 more pushes and then we have to do a C-section, really gets you through it. So I think even if you aren't at your last 2 pushes, just let your doctor know they should give you an ultimatum and you'll be able to get it done, because why not? I mean, most people anyways. Childbirth is a wild experience. But that's my experience with Care for Her. I loved using it. If I were to get pregnant again, I would probably use it again. I had no complaints other than, like I said, if you want to find somebody with a personality that you really jive with and can get to build a relationship with your doctor or provider, then a different primary provider would definitely be an alternative for you, but that's not an option for a lot of local people, and there's very limited amount of doctors. So after I gave birth, we were only there for like 24 hours and 30 minutes. We were really pushing to get out. She passed all of her tests, and I gave birth at like 8:30 at night, and then we left at 8:30 at night the next day. The beds were so uncomfortable. I hated it. I hated everything about being in the hospital. They woke us up at like 5:30 in the morning to move our car from the expectant mother's parking for a COVID clinic. The nurses were good. There's not a nursery in Adventist Health Medical Center, so your baby stays in your room the entire time, which I was 100% okay with. I wouldn't have even sent her if it was an option. Then the nurses were helpful, but not super helpful. They do have a couple nurses that were like lactation consultants, but I really didn't receive a ton of help. I don't know if that was the lack of giving it or me asking for it. We essentially left and I had no clue how to breastfeed. I had no clue, you know, how to do a lot of the things. And they even once said they tried to come in at like 5 or 6 and we were all asleep, and they were like saying our names and we didn't wake up, and I was like, that wasn't like a concern for you guys? I don't understand. It was an interesting experience. It wasn't bad necessarily, it was just interesting. Like, I can't imagine that's how I would handle things, if that makes sense. I did bring some gifts for the nurses, and like I said, they were all super helpful. It was just like an interesting time to be giving birth. It's COVID and everything, so you know, it was like a 7 out of 10 experience for me. If we're including the beds, like a 5 out of 10. Definitely bring your own blankets, your own pillows, your longest charger, shampoo, even a towel maybe. Their towels are not good. I'd love to do a hospital packing bag. I think I have some footage that I took. If you guys are interested in that, please drop a comment down below. Obviously there are some things that I would change. Maybe I could watch what I recorded and review it. But hopefully this was helpful insight to you if you're pregnant in the Ukiah area and looking to find a provider. I recommend Care for Her. Worked out well for us, and like I said, I'd probably do it again. Good luck, congrats, and if you have any questions about Care for Her, let me know, or if you have any experience you'd like to share, I'd love to hear it down below, or any experience regarding the Adventist Health Center. Would love to hear that too. So thank you so much for watching, and I'll see you in the next video. If you have already given birth and you're looking for a pediatrician, make sure to subscribe, because if it's not up now, it will be up soon. A video of the highest recommended pediatricians in town. So thanks so much for watching, and I'll see you in the next video.